All right. So it is 12 o'clock and let's go ahead and get started here. Can somebody put in the chat box if you can hear my voice? I feel like it's not working. Oh, good. Perfect. Sometimes I usually hear a little echo when I go unmute and it didn't do it this time, but perfect. All right. Happy Monday, everyone. Thank you for joining me. For those who might not know me, my name is Jessica. I'm one of the health coaches here at the OSU Health Plan. I'm also a dietitian and a Buckeye Baby coach for the Buckeye Baby program. Throughout my career, I have been serving preconception and prenatal care for about 15 years, and things have certainly changed over the course of time in terms of our recommendations for planning and pregnancy and beyond. So it's pretty amazing. I appreciate the diverse group of participants that are joining me today. The journey to pregnancy and parenthood is unique for everyone. And I want each and every one of you to feel welcome, confident, and supported as you make decisions and navigate your own individual path to parenthood. So throughout this course, you might notice that I will be using some terms interchangeably because I want everyone again to feel welcomed. So whether you identify yourself as a mother or to identify yourself as a delivering parent, I will use those terms kind of interchangeably throughout this webinar. All right, planning to get pregnant, things to consider. Let's go ahead and get started. Today, I want to talk through some factors that can make an impact on preconception care and fertility by identifying lifestyle factors that could impact your health and potential goal of becoming pregnant. You could be doing all of these suggested lifestyle changes or none of these factors and still have a positive or negative outcome. Hopefully you can have some takeaways that you might be able to kind of implement into your own lifestyles and moving forward. So let's start with preconception health. It certainly is a healthy beginning, and it is a set of interventions that aim to identify and modify biomedical, behavioral, and social risk to a birthing person or partner's health. There have been important advances in medicine and prenatal care in the recent years. Despite these advances, birth outcomes are actually worse in the United States than some other developing countries. Many babies are born too early or are born with low birth weights. Among some groups of people, the problem actually is getting worse. So again, preconception care and preconception health care can really make a difference, and we're hoping to make a difference as we move forward. While it is never too early to start planning for a family, most doctors do have a timeline of recommendation in taking steps at least about 3 to 6 months in advance prior to becoming pregnant. The reason for this is we know that eggs, as they begin to kind of awaken prior to the time of ovulation, when the egg releases, this process can be somewhere between 3 to 6 months. So events happening in that time frame, 3 to 6 months before the actual date of ovulation, could have an influence both negatively and positively on the ability of conception and the outcomes of a pregnancy. Preconception healthcare is different for every person, depending on his or her unique needs based on a person's individual health as well. Your doctor or other healthcare professionals will suggest a different kind of course of treatment if there are specific needs based on someone's health. If your healthcare provider hasn't talked to you about it or even hasn't asked you, or maybe you haven't filled them in about what your plans are, certainly ask about it because it can be something important conversation to have. Preconception care is not only for women, it's also for our partners as well. Men also need to take and think about 3 months in advance as well. And that's because of their sperm production cycles. So you'll notice there'll be some recommendations here, not just for one partner, but for both partners moving forward. Even if you are between pregnancies, family planning should be an important conversation, not only with your partner, but also with your doctor. If you're planning to have more children, it is important to understand that recommendation of timing in between children or in between pregnancies. Having at least 18 months between pregnancies can increase your outcomes of having a healthy pregnancy. Some experts do believe that closely spaced pregnancies don't give you enough time to recover from the physical stress what one pregnancy can do to the body and before moving on to the next. For example, breastfeeding can deplete your stores of essential nutrients like iron and folate. If you become pregnant before those replacing those stores, it can affect your health as well as your baby's health. Inflammation in the genital tract that develops during pregnancy, if that's not completely healed before the next pregnancy, that also can play a role. So again, want to make sure that as we talk through this kind of family planning stages, that you're taking some of these things into account on timing, especially, and how it affects you and your family. Additionally, 18 months in between births, if we don't have that time frame, it is associated with some increased risk with low birth weight, small size for gestational age, as well as preterm birth. So again, family planning is just not going to be with your first baby. It's going to be for all of the babies that you might be planning to have. And also just having an idea of what that timeline might look like for you and your family. I know with when I'm working with parents in the Buckeye Baby program, the timeline is important, as some women are waiting a little longer to conceive, and puts them at a higher age. This 18-month time frame is always a big question of, well, I'm losing my timeline is coming up. And so how does that fit in with this? So just kind of giving you an idea of what's recommended. Again, not everybody follows those guidelines, but certainly wanted to put that out there. Part of the planning is also understanding your odds in getting pregnant. Generally, a delivering parent under the age of 35 with no history of complications, of course, have higher odds. Chances start to drop pretty drastically over the age of 35. Certainly not impossible. We are living healthier lives, longer lives. I really do personally predict that this research and charts like these are going to start to change over time. But age, again, can certainly have an impact on one's ability to get pregnant. But again, not certainly impossible, and we're seeing a shift in this. Starting at about age 32, a woman's chance of conceiving starts to decline. From age 35, the fertility decline speeds up. And by age 40, the fertility has really fallen by half. Your partner's age needs to also be taken into account. Men aged about 45 and older are less fertile, and some health conditions are more common in children with older fathers, as well as sometimes there's a slight increase with certain genetic disorders, but again, the research is a little hit or miss with that. The main difference between women and men is that men, there just appears to be no age limit to which a man can actually father a child, whereas women, we have a timeline when it starts to end. As we age, our potential to have children decreases, although the exact time when this starts to happen it's going to vary from person to person. It's going to vary by, or the health of every person, again, is very different. But one other thing I want to kind of put an important note just for definition purposes of what infertility really means, since pregnancy is kind of that potential goal that we're talking about here today. It is 1 year of unprotected intercourse without pregnancy, and that's for women who are less than 35 years of age. If you're over the age of 35, that would be 6 months or longer without protection and without pregnancy. So that's kind of where we kind of define where there could be some infertility concerns moving forward. And then anyone over the age of 40, it's just always recommended for you to be talking with your doctor about where you're at, how to optimize your fertility options, and where your potential kind of health standards are moving forward. There are some lifestyle factors that I wanted to point out that can reduce your fertility or your ability to conceive. So one of those factors, if some of these factors are kind of in your lifestyle currently, it's really just about changing them now, so that way we don't have to think about that as a reaction effect later in life. But smoking has certainly been shown to reduce one's abilities to conceive. Women who are thin or overweight are prone to having ovulation difficulties. Men who have higher BMIs are associated with having low fertility concerns. Vigorous exercise also has an effect. So for those who are exercising more than kind of 4 hours at a time and excessively exercising, that has a negative effect on our bodies. Working an evening shift has been shown to make a difference in some people. More than 4 beverages per week, when I'm talking alcoholic beverages per week for both men and women, have been shown to have concerns with the ability for conception. And I want to point out the reminder of the recommendation of alcohol intake, 1 a day for women, 2 for men. And so this 4 times per week is a completely different recommendation in regards to preparing your body for conception, unfortunately. So something to think about there. Most women who are overweight have straightforward pregnancies and births and have healthy babies. However, being overweight or obese does increase the risk of complications to both you and your baby. And really, again, it's one of those factors that healthcare professionals should point out to you or at least be asking the right questions. I want to clarify when I'm talking about BMI, it's a person's body mass index. It's only a calculation that's based on your height, your weight, and your age. It is not an indicator of your metabolic health. It does not take into account what your body composition is currently, or what's kind of into your body composition, whether you have more muscle mass, whether you have more fat mass. Does not, it's just a calculation. So what we're really referring to when you look at charts, when it talks about BMI, anything that's in the books, go to your doctor's office and they talk about BMI or have your BMI numbers, it's everywhere, unfortunately. What we're really referring to is the amount of fatty tissue that you have, especially inside or between the muscles and skin around your abdomen area. We do know that that can cause more health concerns, but instead of trying to reach for a goal of being in this kind of quote unquote normal BMI range, I really like to say or advise to have a goal of really optimizing you and your body for pregnancy instead. So not just what that number is, because a person can have a high BMI with low fatty tissue and vice versa. So again, it's one of those healthcare numbers that we base a lot of statistics around, but what we're really talking about is that fat mass. So having a BMI under 20 runs the risk of ovulation disorders. Same thing with having a BMI over 30, runs the same risk of ovulation disorders, but also other additional risk factors of having miscarriages, giving birth too early, having a big baby, or even having stillbirths. Men as well who have a higher BMI of 35 may have a reduced sperm count and motility as well. So again, the pressure just isn't just on one partner's, it takes 2 to tango with this. Diet is certainly important, and not just prior to pregnancy, but also during pregnancy. There are many different types of diets that have been researched on how to optimize fertility in both men and for women, and results for that is really just similar for both. Doesn't matter if you are a woman or a man, fertility diet is really the same recommendations for both. Additionally to note, so anti-inflammatory and Mediterranean diets, they always have the most outcomes. We're always kind of weighing ourselves against what the anti-inflammatory diets and Mediterranean lifestyles are. Very healthy. Realistic in this time frame, I'm not sure based on where you live, but both have recommendations for plant-based and whole grain intakes. They both are low intakes of saturated and trans fat, have an increased in fish intake, lower intake of red meats as well. So in general, we want to avoid doing any kind of fad diets. If you're doing a fad diet, you are likely depleting your body of some sort of nutrients, whatever kind of restriction that you're following. There's always some kind of restriction that's involved with the fad diet. And so that's really depleting you of something. So we kind of want to stay away from things like that, whether it's trying to lose weight or not lose weight. Chances are it's not that healthy for your body. There is something that's called the fertility diet out there. It was published back in 2007 by some Harvard researchers. And it found women with ovulatory infertility who followed this eating pattern had a 66% lower chance of infertility issues due from like ovulation and 27% reduction risk of infertility from other causes than women who didn't follow this diet closely. And I don't want to call it diet, just recommendations. So a few of these recommendations to consider just really in optimizing your body are things like aiming for a variety, because variety really is key. Our body needs to be exposed to different antioxidants. And so I kind of like to do this rainbow thing with my clients of, every different color of a fruit and vegetable give you a different vitamin and nutrient. And in addition to that, they help decrease any kind of inflammation inside your body, which I'll talk about here in a minute. Limitation with processed and semi-processed foods. There's certainly a correlation with men specifically with processed meats that reduce their sperm quality. And so limiting those processed meats. Consider organic products or antibiotic and hormone-free meats and dairy products. I know that those come with a heavy price tag, but they can disturb our endocrine system or our hormonal system and can have a negative influence on our fertility. So it's not just all the fruits and vegetables and meats, but if you ever take a look at the recommendations from the Dirty Dozen or the Clean 15, these are the products that have the most pesticides and chemicals that as we ingest, on a daily basis are really building up in our system. So I like to play more in tune to what the Dirty Dozen is kind of offering, because I'm not going to buy every single thing organic, not in my budget. But so take a look at that. If you've never looked at those recommendations, there are some certain ones to be honing on more on the organic area to reduce some of those chemicals in our bodies. So the less trans fat, more monounsaturated fats. So we want to increase on those healthy fats, avocados, olive oils, less animal protein and more vegetable protein. That goes back to kind of the meat quality too. We don't want to have so much of our protein coming from animal sources. More high fiber, low glycemic, carbohydrate rich foods. Really, that's what that's talking about. It's a lot of labeling to say eat your whole grains. We want a whole grain, we want a whole fiber, all that included into our systems. And then multivitamins, we'll be talking about here in a minute. High fat dairy products instead of low fat dairy products. That one has been a lot of controversy kind of behind that because we're so used to the low fat dairy products being offered and quote unquote being healthier. And so there's some way on that kind of option as well. A few other rules to consider, especially with fighting inflammation inside your body. And this is an anti-inflammatory plate, if you've never seen it before. This is a slide from one of my anti-inflammatory groups that I actually will be offering again here later this year. This is not really associated with fertility diet specifically, but you will notice some of the similar kind of recommendations that it has. Inflammation in the body can be compared to like a fire in your body, one that can be stoked by certain foods or even lack of sleep or stress, and it gets bigger over time. And just like a fire, the damage can be lasting. There are many diseases that are associated with inflammation in the body. And as we navigate the readiness for our bodies to conceive or become pregnant, I thought it'd be a good fit to look at these recommendations for nutrition. The breakdown of this plate is no different than the plate method that that's kind of recommended out there in general. But there are a few more additional recommendations I personally like, and I've highlighted to kind of go along with some of these recommendations, along with half of your plate being that, fruit and vegetable, on your plate. Having leafy greens at least once a day is suggested, very specific with that. They want you to kind of be interchangeably changing your leafy greens as much as possible, but at least having a leafy green, a serving of leafy green once a day. And then incorporating 5 or more cruciferous vegetables specifically into your week also is a big recommendation with reducing inflammation inside your body, which again is easier said than done if we think about it with cruciferous vegetables. They are not the most popular vegetables out there, but they can do some wonderful things in our bodies. Another highlighted thing I wanted to point out is the recommendation of eating fatty fish 2 times per week. That's also a big suggestion in the Mediterranean lifestyle and diet. That's going to come along with the omega-3 fatty acids that are really important. And honestly, our Western American diet just does not get enough of. We have too much of the omega-6s, not enough of the omega-3s. So just again, a couple of highlights I wanted to show in terms of just reducing inflammation, getting our bodies kind of in that healthier range internally. Vitamins are always going to be an important factor. We all don't eat perfectly every single day, and supplementation with vitamins can help fill in the gaps. And they're a complement, not not a substitution for good health, of course, but certainly can complement our bodies. Folic acid is always going to be vital. While it's not going to make you more fertile, it is more crucial that women trying to conceive obtain at least 400 micrograms per day of folic acid from a supplement. Also considering, taking it in by foods like your dark leafy greens, which we should be having every day anyways, and fortified grains. It's really needed again as you prepare your body, but it's also going to help with any prevention of neural tube defects moving forward too. There's also been some studies with folic acid for those who are pregnant that helps them with decreasing the risk factors for premature births as well. So it's some pretty fantastic stuff when it comes to folic acid. One thing I also want to note is that if you do have a BMI of 30 and above, it is advised for you to be taking a higher dose of folic acid, so more like 5 micrograms per day. Again, talk to your doctor about that if that's something that it falls in your category with that. Vitamin D is not recommended for all women, but certainly for those who live in certain areas in the United States, like us here in Ohio. It's a common deficiency. We know it's a precursor to a lot of different mechanisms within our bodies. And so you will see vitamin D as a recommendation with a lot of different concerns moving forward with health. And so I always say just have your levels checked. They do check them on your annual visits. And so just they should be pointing them out if you are low or getting low. And then again, omega-3 supplementation, because we need it's a huge gap within our nutrients and vitamins, is always a good for supplementation as well. You'll notice too with prenatal vitamins, which that would be my recommendation if I should ever recommend a vitamin. They are now being supplemented with omega-3s or DHA inside the prenatal vitamins as well, which is great. Exercise and movement is certainly going to improve your chances of pregnancy. And it's not just for women, it's also going to be for men as well. We know that physical activity is essential for good health, that I don't have to ream into anybody. Like we know it. It's likely that you might have a higher content of fatty tissue around your essential oils if physical activity or exercise is not part of your lifestyle. So this is regardless of what your BMI calculation might be. So more of like, are we burning some of that stuff off? Additional exercise and movement has a positive effect also on your immunity, decreases some of that inflammation, and it can help sperm production and egg quality as well. So as always, there's a such thing as too much of a good thing. Of course, like I mentioned before, exercise is stress on the body technically. And so, of course, it's a good level of stress, but in moderation. So I mentioned before about too much exercise that can be harmful in your body. So it's those who are exercising excessively, kind of ranging in that 3 to 4 hours per day of exercise. So likely if somebody who's in the gym that long have a different set of goals, but something to consider. Lastly, sleep does not get enough attention. It's often overlooked as a priority to health. As adults, we are recommended 7 to 8 hours of sleep. We know that for a woman's body, if she's on average getting less than 5 hours of sleep per night, it can become a barrier of conceiving and getting pregnant. And for men, sleeping more than 14 hours per night, which I did not know that was possible, but if they are, can also create a barrier for conception or for sperm count. So again, I mentioned before about night shifts. We know that they have more disturbed ovulation and have a likelihood of menstrual irregularities from working night shifts. And a lot of it has to do with their limited quality of sleep, who are awake while most of us are sleeping. And there are some other kind of circadian rhythms that are going on and that are kind of off rhythm for them as well. And when things are being released and not released with enzymes and hormones. So it can disturb you. Again, it's not making it impossible if you do work night shift, something to consider if, you're planning purposes. So something to think about. If you are a member of the OSU Health Plan, there are some great benefits to take advantage of. Of course, I like to recommend a personal health coach for those who need some help or accountability in their health. That's certainly an option. Once you become pregnant, we have the Buckeye Baby program to help you navigate your pregnancy, so you're not alone with that. There's so much information and benefits. So we help fill you in with those important benefits and resources to take advantage of. We have a really great rich kind of resources with our benefits with that. So it's fantastic. EAP is always going to be a great option, whether it's now or later. They're there for you as well. One question we get quite often, especially with the Buckeye Baby program, is can I join it since I'm thinking about becoming pregnant or planning for a family? There's no restrictions that you can't join. A lot of the information is more in tune with prenatal care and the benefits to take advantage of during pregnancy. The benefits webinar that we have with the Buckeye Baby program talks about numbers, and if you're a numbers person, you can kind of plan for that. What the cost factors are behind that. But again, it's more recommended to kind of wait till that time comes as we're kind of in the moment talking about what's going on at that time. All right, I've got a couple of extra minutes there. Sorry, I hope I didn't talk too fast. I did have an extra cup of coffee today. But thank you for joining. I hope there are some things that you could have takeaways or a better understanding with what possibly could be a barrier, what possibly could be helpful. Feel free to either email me directly. I'll send out the slides as well as the recording to this here later this afternoon, and you can always chat with me via email, or you can put something in the chat now. Either one is perfectly fine. I'm gonna stop recording here.